what might be the value of the proposed 2019 NSECE for states? We do have data, we would have data from all 51 states, and so at a minimum, these data allow us to learn about how providers and workforce members in one state compare to similar states or to the rest of the nation. I do a lot of work with state administrators in human services areas, and we often hear the question, well, I just wish I knew how it worked in other states. And the beauty of national data are that they can allow that kind of uniform, comparable data across states to support some of that questioning. Again, the study would provide data to support reporting about program availability. Some of the specific policy areas that the data should be relevant to would include subsidy eligibility rules, health and safety requirements for child care providers, professional development systems, how quality improvement efforts are being implemented, particularly on the workforce side. And then the final area is kind of, well, what can I know about my state alone? And this is a trickier question because you may have noticed that our 50 states in the District of Columbia vary tremendously in many characteristics, including size. The laws of statistical sampling design mean that we really draw samples in each state approximately proportional to how many people there are in the state, how many children there are in the state. That's not a perfect description of the statistical approach, but certainly large states have more NSECE sample and small states would have fewer NSECE sample. What that means is that what analyses are possible vary dramatically depending on the size of the state's population. I'm going to try to give you some sense of how that variation works. With the 2012 data, so we know it works because they've already demonstrated it, is that we've seen comparisons across states of, say, workforce characteristics or the availability of public pre-kindergarten. We've also seen researchers use variation in state policies, for example, for subsidy receipt, to say, look, you know, in states that have this kind of wait list or this kind of reimbursement rate, this is what we see happen in family search behavior or what center quality looks like. And so you could find your own state in those types of subsidy profiles to understand what the data would say for a state like yours. And then in selected cases, people have conducted single state analyses of workforce needs, of households' geographic access to subsidized care. It's perhaps only mildly a coincidence that Illinois, where NORC and our partner Chip and Hall are located, is one of the states that has been able to do Illinois-only analyses of NSECE data. So you no doubt would like to know what is possible for your state, and unfortunately the answer is always, well, it depends. But this slide tries to give you an idea of how this would work. What we've done here is organized all 51 states, including DC, into 3 categories: the purple column on the left, the orange column in the middle, and the green column on the right. I'm going to start with the right-hand side. So we're focused on how many center-based providers serving children 0 to 5, not yet in kindergarten, are located, are available in the NSECE data from 2012. The green column on the right shows states with 100 or more center-based providers. This is a fairly large number of cases, which means that various analyses of ECE providers and the ECE workforce are possible for those states. There's some variation across these states, of course, but it is possible to generate state-specific estimates for these states. So you could say what is the proportion of center-based providers who receive public pre-K funding in California. That is an answer. That is a question that you can answer for the states in the green column to the far right. Then the orange column in the middle shows states with somewhat smaller numbers of interviews. For these states, there is a much more limited set of analyses that are possible, mostly taking the entire state and comparing it to other states or national numbers. So, for example, it might be possible to describe the average hours worked by all center-based workers in Connecticut, but not to separate that out by those who are working with infants and toddlers versus preschool children, things like that. And then the far left is actually the list of states that have the smallest number of interviews. In this case, we're talking about center-based providers. And so these are 50 or fewer center-based providers in our data file from 2012. The number of interviews in the 2012 data basically prevents any state-specific analyses in these states, meaning we could not say Delaware has centers that do X. And that's because of statistical reasons, meaning the validity of the data, as well as privacy protections that we have in place to limit what people can say about the data publicly so that we can make sure that our respondents' privacy is protected. The 2012 NSECE public data sets can be downloaded by anyone on the internet, and those data do not include identification of states. We wouldn't expect 2019 data files to include that either. However, we have a variety of mechanisms in place so that researchers can access geographic identifiers under controlled conditions, and we have, I think, close to 100 researchers who are doing that at this time with the 2012 data. In the interest of time, I'm not showing the similar tables for home-based providers and center-based workers. I will say that in general, fewer states have large samples for home-based providers than for center-based providers. So if you look at these columns, being on the right-hand side means you can do more analyses, and doing on the left-hand side means you can do fewer analyses. For the home-based providers, everyone kind of moves to the left. And then for center-based workers, the table looks very similar to what you see here for center-based providers. So as I just described, the national study is designed and would be executed in ways that are relevant to states in a variety of ways, but there's no guarantee that the sample in a given state would align well with that state's priorities. And so one of the things that the study includes is a feature where OPRE allows states to supplement some of the national study activities with state or local funds. So as you can imagine, the study has a lot of data collection operations, sampling expertise, analytic tools that are not readily available to many states. And so we've tried to identify a few ways that might be particularly valuable for states who would be interested in taking advantage of the NSECE enterprise for their own priorities. One of these is to commission additional interviews to be conducted in your state. So the national study, based on the rules of statistics would have a certain number of cases allocated in each state, but you could choose to add funds for additional sample to be collected in the state. A second option is related to that sampling frame construction process I described earlier. We will be building this frame. It's rich, geographically detailed data that connects population features, like from census data, with geographic information, with provider lists. You might even, if you had inspection data or QRIS data, want to enrich those data in a variety of ways. And we could, as part of our process, help your state build that kind of enriched statewide list of providers, even if we didn't do any additional data collection with that. So that would be more like a research tool that we would provide you that would take advantage of our list gathering, compiling, geocoding, and other analytic capabilities. And then the third option would be to support linkages to state administrative data. So you all may have subsidy data, you may have other private information that you have in your administrative data files that could be linked to the survey data for analytic purposes. And so that would be a third option, is to commission some linkages. So if you were interested in the data collection option, there's so many variables that there's really not a one-size-fits-all process. We would encourage you to write us, again, at nscc@norc.org. And if you can describe what you would be interested in, for example, are there populations of interest, such as low-income areas or rural areas? What group, what are the types of questions that you're interested in? Then the NSECE team can help spell out what would be possible within the NSECE design and give you some cost estimates for what would be involved there. We did have 2 states in 2012 that took up this option. If a state did supplement the data, then those data preparation, data collection activities would all happen in conjunction with the main study, and those data would become part of the NSECE data files. But it is possible, especially I think for states in that middle column of the tables that I was showing, the orange one, to move themselves to the far right to expand the available feasible set of analyses if they wish. We'd be happy to talk to you about that. I mentioned we could do a sample frame supplement for you. This would be helping the state to achieve a more full-featured list of all of the providers and some understanding of how they connect geographically and with population characteristics. The screening of elementary schools, which I mentioned, is a step that's often not feasible for local researchers, and that would be part of what we would do. We found, in most states, double-digit percentages of providers are located in school districts and not on any of the existing lists. And then the third category I mentioned was commissioning analyses that link the state's private data, for example, on subsidies, either provider subsidies or families, either subsidy files about providers or subsidy files about families, to the NSECE data to answer questions of interest. The analysis opportunity has kind of its own timeline because that would happen once data are available. But if you were interested either in supplementing the data collection or in this sampling frame option, then we would need to be talking with you fairly soon, so that by the end of August, we'd have commitments about which states we're going to supplement project activities in a variety of ways. Data collection would be expected January through May of 2019, and the first data files should be available in September of 2020, with analyses beginning in 2021 and, of course, hopefully continuing for many years.